All right, we're ready? Thumbs
Yep.
up? Okay. Hey, welcome everybody. Thank you for joining us for today's webinar. My name is John Lacey and I'll be your host. I work for the University of Tennessee System and I'm one of the organizers of the Pandemic and Possibility webinar series. And before we jump into this, we're gonna do a little bit of breaking of the ice, so to speak, this morning. And John, if you could go ahead and post a link into the chat window. Everybody,
Yes,
direct your attention to the chat box over here. If you would copy that link and paste it into your browser, and I'm going to do my screen share here. Yes. Okay. And I want you to respond to the prompt. What industry do you represent? Where are you coming to us from today, industry-wise? What type of work do you do? And we'll watch your responses get populated in this word cloud. And this will give our presenters an idea of the audience that's with us. And we'll just give a minute to this activity. Seeing education, higher education, real estate, higher education.
So they get bigger the more responses you get in that?
Yep, they grow as more people who are in those areas have those responses. So presenters, you can kind of see we've got a pretty wide variety of industries here: healthcare, construction, architecture, nonprofits, offices, real estate. Awesome. Well, thank you all so much for doing that. That's really helpful. We're so grateful to our presenters for dedicating their time to us today and sharing with us their expertise. This morning, we're presenting Rethinking and Reconfiguring Healthcare Office and Retail Space Amid the Pandemic. And in this session, we'll be discussing the changes that we're seeing in healthcare, office, and retail spaces as a response to the pandemic, as well as the possible outcomes for future space needs. And before we get going, just two housekeeping points. If you have any questions during the presentation, please type them into the chat box, and we can bring those up during the Q&A. And we can also unmute you during the Q&A if you want to ask your question verbally. And of course, we expect everyone to follow a code of conduct that is outlined on our webinar website. And with that, allow me to introduce our presenters. We have with us today Hank Carr. Hank currently serves as a Senior Vice President in the Realty Trust Group in the Johnson City, Tennessee office, with responsibility over day-to-day operations and client interaction. Additionally, Hank serves as the Operations Service Line Leader, overseeing 38 team members and nearly 14 million square feet of managed space across the Realty Trust Group portfolio. Prior to joining Realty Trust Group, Hank served as the president of Corridor Properties LLC in Johnson City. He's been in commercial real estate since 1986, gaining broad experience in land use planning, development, property management, project management, and general brokerage, with an emphasis in the land office and medical office sales and leasing. And also with us is Richard Spoor. Richard is a member of the law firm Bass, Sims. In his more than 25 years of practice, he has advised hundreds of real estate investors and other capitalists on how to best reach their business objectives through three primary areas: commercial real estate and lending, business and transaction planning, and business divorce. He has represented private investors, publicly traded REITs, and institutional lenders in commercial real estate projects across the nation, involving office, retail, industrial, multifamily, hotel, hospitality properties. We also have with us Holly Buchanan. Holly serves as Senior Director at Katz & Associates in their Nashville office, which she helped open in 2017. Holly has extensive knowledge and expertise of the Tennessee markets and has built strong relationships with local brokers, owners, and developers. Holly has devoted 20 years exclusively to retail site selection, leasing, and retail office sales. Her primary focus is on helping retailers and restaurants expand their footprint throughout Tennessee and the surrounding states of Alabama, Kentucky, Arkansas, and Mississippi. And last but certainly not least with us is John Thurman. John is the Vice President of McCarty Holsapple McCarty Architects and Interior Designers, serving as the Director of Business Development. John is always looking for ways to improve the design profession. With his engaging and extroverted nature, John finds fulfillment in transforming a client's needs and desires into reality. As a project manager, he enjoys shepherding a project from concept to completion by leading, coordinating, and collaborating with all team members. And so with that, I'm going to go ahead and turn it over to John to get us started.
All right. Thanks, Saul. Thank you, John, and the UT team. We're excited to be here today. I just wanted to say this program was initially titled, with a focus on healthcare. And as we started thinking about rethinking and reimagining spaces post-pandemic and amid pandemic, I thought, it would be nice to broaden the scope of all different types of spaces so we could have a broader audience. So we've added in the healthcare, besides healthcare, we've added in the retail and the office components to that. So also related to the presentation format, we were thinking, how do we present this topic? This is ever changing. All of a sudden we're in a pandemic and people are working from home, technology, all the issues you're aware of. And so we thought, let's set a baseline. Let's start with the pre-pandemic. So this will be brief. This will be, so each person is going to present about their expertise. And so, for example, you're going to hear about a pre-pandemic healthcare spaces and the trends that way. And then also likewise for office and retail. So I just wanted to emphasize that that's going to be a brief part. Then we're going to talk about what we're experiencing now. So, changes that are real time that we're currently going through, how people are adapting their spaces real time. And then at the end, it's going to be what we're titling possible outcomes, which are some possibilities of things that could have a long-term effect on our spaces. So also just talking about our team very briefly, I thought this is a statewide presentation. I think we should have all parts of the state represented. So I reached out to some real estate professionals across the state. So we have, all the grand divisions represented here, Johnson City, Memphis, Nashville, Knoxville. So I thought that would be helpful. And then of course, their expertise in these specific real estate specialties. So with that, we're going to kind of keep our presentation to maybe about 45 minutes. We'll have a lot of room for questions at the end. So I hope everybody's thinking about that. And then, also want to use the chat actively. So maybe as we're going, one question that that could help us would be to type in what your biggest issues and largest concerns are about your spaces, no matter what type of space you're in, as we're in this pandemic and then thinking about the future. So with that, I'll turn it over to Hank to take it away.
Thanks a lot, John. I appreciate it. Can everybody hear me okay? Great. So thanks for spending a little bit of time with us today. I'll give you a quick snapshot of what the world looked like kind of pre-COVID. In my travels and in my day-to-day work, when you think about real estate and healthcare, first thing you have to acknowledge is it's a heavily regulated industry. Centers for Medicare and Medicaid Services have a lot to say about healthcare space, how it's designed, how it's used, who uses it. And so we had these regulations behind us that had a lot of guidance on how things happen. I would tell you that in the before certainly in 2019 up until that point, everything was focused on the patient experience. Every healthcare provider was trying to get these great customer service scores. They were trying to get their HCAP scores up, and because that really mattered to CMS, and it mattered in how they marketed themselves. They had minimal barriers. You look at this top right screen, you rolled right up to the desk. There was never any glass between the patient and the person coming in, the receptionist taking your information. And it was this very open environment. There were minimal barriers to entry. All their buildings were just wide open. You could enter in multiple locations. It was all about the patient experience. When you got into those units, you had You had this very clean, almost homely feel, pictures and minimal room signage. If you had a door number, if you had a room number on a door, I would be surprised. One thing I threw in here, just as a side note, you had unregulated cleaning specifications up to that time. And I'll talk more about that, but everybody had the ability to kind of run their own show, design it the way they wanted it. It was all about the patient. One of the things that was going on pre-COVID, you had, the more people they could put in the smallest space was kind of how they did it. It was all about efficiency from operations, saving money. You had large waiting rooms. Everything was built around the patient's experience. As you kind of fast forward to kind of where you're at today, and if you'll catch that next slide real quick, it is a very different world today. And I put these slides in here to just kind of show you almost the chaos of what's happened in our healthcare real estate world. Yeah, the federal regulations have relaxed. Okay, that's how we've gotten the ability to go out here and set these little remote tents up for pre-screening. That wasn't legal technically under the federal guidelines. Today, it's all about the patient and the staff safety. And I didn't even mention the staff before. It was all about the patient. Well, today, it's a very different world. It's now everybody's trying to figure out how to keep everybody safe and get the business going again. You had paper signs everywhere in these offices. There was no way to really guide people correctly. There was no way to tell you who was in a room. They set up all these temporary barriers, which people just kind of looked around, by the way, and they do serve a purpose, but you have lots of plexiglass barriers out there. You had temporary desks in hallways. You look down here, bottom left corner. This is very common today in many of our office buildings. We see, pre-screening desks or counters or fold-up tables in this case, blocking hallways. And so what was a 5 or 6 foot hallway might have 3 feet left for the patient to navigate now. And they're, so much for social distancing there. You're walking right up on people. It's very difficult to even figure out how to manage this world today. You have inadequate staff areas. You can't, if your staff needs to be 6 feet apart in order to sit in the same area, it's very difficult to do, because before they were really compressing the most people they could into these workstations. Today you've got building access and controls in place. So we've now had to stop people from going into spaces, into buildings. That the days of multiple entries, everything's now got one entry so that we can funnel all the patients into one area and try to get them tested even before they get to the office. And then when they get to the office, they're going through a pre-check and a screen, or sometimes people will come out to their cars. And so this whole experience of how to use your real estate and how to engage this patient in this process is it's starting to find some rhythm, but it still very much looks like this today. And so I'll stop there. I'm sure it'll generate some questions, and we'll talk more about the future in a minute. I'll turn it back over to John.
Okay, thanks, Hank. Richard, you're up to talk about where we've been and what we're seeing now for office space.
Yeah, let me unmute here.
You're good.
So yeah, you're good. So I'm coming at this really from two perspectives. On the one hand, I'm a lawyer at a good sized law firm, and so we're major consumers of office space, and therefore we've got the office tenants perspective, right? And also spend most of my professional life working with commercial real estate types, developers, investors, owners. And so I've also got the landlord perspective on this. And that's the two prisms that I'm approaching these issues through. The pre-pandemic state of things, there have been changes. I've been practicing law a little over 30 years, which is kind of sobering to say. And our office pre-pandemic, our offices had changed significantly from law offices, general offices when I first started practicing law, but it was not radical. I mean, so for example, one significant change is in late 1980s, when I started practicing, we had large law libraries that were filled with books, took up a lot of square footage. Now in 2020, it's all digital, and that library square footage has shrunk to essentially nothing. So there have been changes, but you would still sort of the law office of 1987 is easily recognizable in 2020. So there have been radical change in the way our professional offices, I think at least, are configured. And immediately before the pandemic, we had a pretty good office market from an investment perspective. It wasn't red hot. It was better than retail, not as good as industrial and multifamily, but it was a pretty good market. One sort of data point for the way the world looked, at least in our office pre-pandemic, that I think is interesting is we did during this pandemic, and I'll come back to this, we did a survey of our lawyers about how they used space. They thought about working from home, what they thought about working from office, sort of trying to get some sense of how things had changed during the pandemic. And one of the data points we got was that pre-pandemic, over 90% of our lawyers worked at home 1 day a week or less. So, I mean, functionally, the vast majority of our lawyers had little experience with working from home. And frankly, most of them didn't really want significant experience with working from home. So we can fast forward to the pandemic, and it's really been a major disruptor, both on the user side and I think on the landlord and on the owner side. I mean, on the user side, to go back to that survey we just talked about, and to me, this is a shocking result. So I said pre-pandemic, over 90% of our lawyers had essentially no experience with working from home. Post-pandemic, or now during the middle of this pandemic, the same survey shows that over 70% of our lawyers are now willing to work from home 2 days or more per week. Now, let me say, lawyers are not great change agents. As one of my partners said, he would leave the furniture where the Greeks put it. And so for there to be that kind of sea change in an attitude for lawyers shows that working from home is actually a thing. I mean, we're the prototypical late adopters. So if 60% of our lawyers are willing to do, if 90% pre-pandemic would never do X, and now post-pandemic 70% are willing to do X 2 days or more a week, that's a big deal. On the owner and investment side, it's been a major disruptor. It's introduced a lot of uncertainty into the multi-tenant office market. Single-tenant office space really hasn't, I don't think has been impacted very much. Multi-tenant office buildings has had a pretty big impact. You can see it among other things, fact that office REIT performance year to date, investment returns are down 30%. I mean, and that's in a time where equity markets generally, obviously we had a big dip back in March and April, but equity markets generally have performed well this year. And interest rates almost literally couldn't be lower than they are, which is, obviously helpful to the real estate industry. And still, even with all that, as I say, negative 30% year-to-date return on multi-tenant office REITs is something to pay attention to. There was a survey done by the National Real Estate Investor where they were evaluating the investment attractiveness of different commercial real estate sectors to investors on a scale of 1 to 10, 10 being the most attractive. Retail was the lowest, 4.3. Then multi-tenant office was at 4.6. Multifamily was 7.3, and industrial was at 7.7. So, 4.3 and 4.6 at the low end, 7.3 and 7.7 at the high end. Lawyer math tells me that means that investors view industrial and multifamily as about 75% more attractive than they do multi-tenant office retail right now. And the fact that retail, which is, and we're going to hear more from Holly, this retail has been challenged for a while now. The fact that office is viewed just a little bit better than retail, multi-tenant office just a little bit better than retail is pretty sobering right now. And so, and I think a big part of the problem with office space, and this is going to be a theme, is just the uncertainty involved. I mean, office rent rolls have not been impacted to the same degree as retail building rent rolls have been impacted. But they had been impacted. In other words, there's been erosion in tenant quality. There have been some, more lease defaults than you would expect. Tenants going out of business. As I say, not nearly the same impact as retail, but there has been some rent roll impact. I think also we're seeing is that the way that rent roll gets valued, which in my world, real estate world, is investors typically apply capitalization rate to a net operating income they get from a rent roll to come up with a building price. So the higher the cap rate, the lower the price. There's an inverse relationship there. And I think there's no doubt that we're seeing some cap expansion, some cap rate increases during this period of time to reflect the uncertainty about what the post-pandemic world is really going to look like on this front. And we're not really sure, I don't think, what that cap rate expansion looks like, because frankly, we don't have that many data points on office investment sales since it all went to crap back in March and April. I think there have been just very few, it's not quite as bad as it was back in 2008 and 2009 during the meltdown, but it's multi-tenant office sales since March have been pretty slow. I have one data point which I'll share with you personally, which is at a client that had an office building under contract for $35 million back in March and April. They terminated the contract back in April because of sort of uncertainty of what was happening and the impact of all this on the rent roll. And we just got it back, the same property under contract now in November for $32 million. So there's not been the rent roll has not been significantly impacted for this building. It's not been significantly impacted by COVID. So you're basically talking about a $3 million, 10% COVID uncertainty haircut on the pricing on this particular building.
Okay, thanks, Richard. Holly, take it away on retail.
Hey, John. Good morning, everyone. I'm going to bring color to this retail fund and this group. It's a mess. Where we've been struggling to adapt, decline of malls. I mean, this has been going on for probably the last 10 years. Brick and mortar retailers host a number of challenges. Aging malls, probably the biggest is fickle consumers. But overall, brick and mortar isn't really dying. It's just going into a new era. The United States is completely over-retailed. The U.S. is the most over-retailed country on earth prior to the crisis at 23 per square foot per person. The next closest country is Germany at 2.4. So that's a huge number. Leveraged buyout, massive debt. This was happening even prior to COVID. It isn't all e-commerce. It's really debt. I mean, if anybody remembers Linens and Things and Sports Authority, The Limited, Claire's, Payless, H.H. Gregg, the list goes on. And again, this was all pre-COVID. 34% of publicly traded apparel and department stores were displaying signs of financial distress way before the crisis. And then lastly, consumer experience. Everything had become, coming out of the last recession, everything was hands-on. It was experiential. Eating samples in your grocery store, spending an afternoon in the fitting room, trying on makeup and things of that nature. That's what it was all about. Music in the malls. You can see in this picture, this is obviously Black Friday. Not sure, and we'll talk about this later, not sure that we'll ever see that again, that type of crowd. Lauren, you can go to the next slide for me. Maybe not. No? All right, I'll keep going. Some big winners that what's going on right now is the grocery stores, Walmart, Target. Food has been hit really hard. You're going to see them trying to go to more takeout and curbside. Sorry, I'm struggling here. I don't know if there's, give me, hang on a second. Yeah, okay.
Mine's gonna
I can't. There you go, John. There we go. It's been all my glitches all morning. Even trying to get on.
If I need to run with it, Lauren, I can.
Yeah, it's not letting me go to the next slide for some reason.
Let me see.
Go ahead, John, if you want to take over.
Yeah. Let me just real quickly.
So Holly,
Bear
you
with
don't,
us, guys.
you don't anticipate us seeing a Black Friday like the one pictured there again?
No, I really don't. I mean, I think there'll be, I mean, if you have that, it'll be obviously masked. It'll be roped off. I call it cattle calling. Lines and arrows all over the place. Even the mall hours. I just looked it up. Cool Springs Galleria here in Franklin. Black Friday is 7 a.m. to 9 p.m., which is not the norm. They're closed Thanksgiving. We had, they had brought the whole Thanksgiving push in the, opening at 4 p.m. on Thanksgiving for extra special deals. I, out of curiosity, went with my mom to Macy's at 12 p.m., midnight, a couple of years ago, just because they were doing even more sales pushes. And you just, I think everybody has learned from this that those extra hours, all it does is spread the employees thin, and they don't have time to restock. The stores are a mess, and it just isn't helpful.
Oh, yeah, you seeing
but what
my
we're
screen
seeing
now?
now, I am. Thank you.
Okay, great. Yeah.
So what we're seeing now are the big winners, and everybody can relate to this. Grocery, general merchandise, which I mentioned was Walmart and Target, home improvement, and pet supplies were all big winners during COVID. You still have to see, your dog, your cat. Home improvement, I'm sure everybody on this call painted something, fixed something, did major landscaping improvements during the spring and summer. And then we all had to eat, obviously, and probably, I know in my household, my two teenagers were eating me out of house and home because we were home. We weren't playing soccer. We weren't, at cheer and whatever. I had to learn how to cook again, basically. And then your struggling categories, again, obvious, right? I don't know about furniture. I think that one, it's taking forever for me to get things online. I think the supply and the demand, at the beginning of COVID, furniture took a really hard hit because people were not buying those luxury items or what's considered luxury. But I think by August, people had been home long enough and they're like, I really hate my couch, or I need a new bed or whatever. And so I think furniture and home accessories are coming back. And then obviously restaurants have just, the ones in good locations, the ones that had really, really good food, that we're doing well at a higher level anyway, are going to come out okay. I'm not going to say they didn't take a hit, but then the ones that were struggling are going to struggle. So that's kind of where I am as far as retail is right now, and I'll talk more about the outcomes in a little while. But
Sure.
All yours, John.
Yeah. Okay. Great. Thank you. All right. So that's the summary of sort of where we've been, and now I think we'd like to talk a little bit about what we're seeing as moving forward here. So, Hank, you want to start there? Hang on, Hank, you may need to start over.
There we go.
There you go.
Yeah. Trying to keep the noise down on my side. When I started this slide deck, I started off with federal and state guidelines, and I got to tell you that continues to really be something we're watching here, because previously in the healthcare world you had guidance on how things had to be designed and operated, and you had to collect rent all the correct way. Well, all that got relaxed. I right now that is still a little bit gray in terms of how we operate these real estate portfolios as it relates to hospital versus and physician engagements. But I do see that coming back to pre-COVID levels in the fairly near future. The days of relaxed rent collection and free rent are probably they've already gone officially. But unless there's just a real change here in the next few months, I see it going back to pre-COVID levels. I do believe that whole experience between the patient and the staff is going to change in the future. There'll be a balance between how those two groups function. Um, you know, they call it patient-centered care guidelines, remove all the barriers. Well, I think they'll start to rethink how those barriers are set up in the future. They will have the ability to isolate themselves between the patient and the staff in the future, and they'll go back to having some barrier in place. I think that makes sense myself even from a flu perspective. But I do think that the healthcare industry overall is going to learn from this experience, and they're going to plan for. We hope we never experience another pandemic, but we have these all the time now anyway. It's called the flu. We have a way to defeat most of that, but they'll begin to plan differently, and so they'll start to plan for buildings with access barriers for temperature checks and wellness screenings. Okay, now those areas, those access barriers may guide people into a bigger common opening that's just one access area, and there may be alcoves off to the side where they store wheelchairs when we aren't in times of crisis, but they will have the ability to set up tables in these areas or be able to funnel people by a desk to do those screenings in the future. I think those hallways will be wider in the future. I think you'll have, more enhanced signage just to get people to the right place, to identify rooms that are of concern that need to be cleaned and sanitized. That was one of the early lessons we learned in this process was, the early guidelines said, hey, this room's been, you'll use the term contaminated. There's been a positive case. This is early on. And nobody really knew what to do with it, how to identify it, how long it needed to sit. So I think you'll see some different kinds of signage in the future that will be more versatile. And it's easy to do. I just think it's things they're going to start to think about. I do believe that the cleaning specifications, that part is already kind of taken hold, but it will become a requirement in these office spaces as we go forward to dictate how these units are cleaned on a going forward basis. I do think that when you get in, you get from the entry to the building to the office location, they will think of ways to begin to have screening areas for patients. They will get back probably possibly to a well and a sick waiting area. We've gotten away from that in recent years. I think I know of only a few in the portfolio I look after. And then you look at automated check-in. That I think so. That's something that is very prevalent in some areas of the country. I think Richard used the term early adopter. Well, in this case, I know in our market, those have not taken hold yet, but I see that again, it's going to limit that engagement between the patient and the staff. I believe these will become more and more prevalent. I believe the remote check-in from your car may be beneficial to say, hey, I'm here. I think all those things will be part of the future. Somebody, I don't mention it here. We talked a little bit about, somebody had mentioned earlier about telehealth and how it's going to impact the healthcare platform, the real estate component. We haven't experienced that yet in our market. All right. We have some clients who have seen a growth in their telehealth platform. And I certainly see that as staying. I said, you're going to see more and more telehealth, but I think there's a generational thing. There's a population demographic that will accept it and embrace it. But the older generation, of which I participate, I'm a member of, is probably going to still want that face-to-face time. And so telehealth will grow. I don't see it changing the office, the medical office platform today. what it's going to do is free up exam rooms to have more providers, and we may need a few more offices in these medical practices for these physicians to go back and do telehealth from, because today we've taken all their offices away. They've all got touchdown areas. Well, as telehealth becomes more and more prevalent, you may see more private discussion areas because of HIPAA requirements. They'll have to have private rooms to conduct these telehealth visits. Yeah, these telehealth visits could be remote in a big call center type environment. Those are certainly taking place as well. So I think there's going to be some very gradual and continued change in how that patient and that staff interacts. And that's the biggest thing we're seeing. John's back to you.
Hank, do you think the footprints of the suites and tenant spaces are going to increase due to the screening spaces required and these additional telehealth rooms, et cetera?
Yeah, I personally think that some of these entry areas are going to change, and that's going to change the square footage requirements. I mean, they're the days of this, little hallway where everybody comes in through an automated door. I think there'll be some. They'll think through that ability to have an alcove off to the side that maybe serves as a wheelchair storage area today, which most buildings need and don't have. And that will double up as their screening area in the future if they ever want to use it. I believe that as telehealth becomes more embraced, you'll see some private rooms for the physicians and the providers, the PAs and the nurse practitioners to be able to get away and have those private consultations. Those don't exist today in many of these MOBs. Most of the new MOBs that I've participated in the design of in the last 4 to 5 years, we've been eliminating private office space in favor of just quick touchdown areas, 4 or 5 physicians all sharing a space. Well, that's not going to really work as you go forward. So I do think that gets changed, but I have not had the experience of designing one of those yet. So yet to be determined.
Yeah.
Hey, Hank, I have a question for you.
Yes.
We're seeing more medical come into retail. In a retail strip center in Spring Hill, I just did an orthopedic group. Do you think that's a trend? That was a trend even prior to COVID. Do you see that more and more, where the patient literally can roll up to the front door for PT, whichever? Or do you think that's a sector driven?
No, I think it's a trend that will continue to grow as these retail boxes become vacant, which I know is not your ideal situation, Holly. The concept of a medical mall is becoming very popular, certainly to my clients, and it's a trend that I see, and I believe you're going to see it continue to grow because, again, it gets back to patient. So it gets back to the service aspect of the industry. How can we make it easier for the patient to come to one location and get an urgent care, walk next door and pick up a primary care physician, go down next door and get diagnostics taken care of? And oh, by the way, we have a center for aging at the end of it and a pharmacy. And you take all of those, and now you've consumed 30,000 feet, and you've done it in a our experience has been you can buy these retail centers as they become vacant at a discount, still spend a lot of money on them and have for less than what ground up construction is going to cost you. So yeah, I definitely see that as a trend.
Oh, well, and probably one of the best case studies is here in Nashville with 100 Oaks and Vanderbilt taking over the old 100 Oaks Mall. Vanderbilt taking the whole second floor, and then they did big box on the bottom with TJ Maxx and, Burlington and all of that. So that's a great case study.
Yeah. The other piece to this that bears mention is healthcare used to be an industry that was all, it was all referral driven. You went to your primary care, you built a relationship, he or she sent you off to your orthopedic group. And that's still important. but it's very much a retail business today. They're competing heavily for the dollars. Okay, as the federal government, we talked about CMS earlier, as they deregulate certain areas, and as states start to get away from certificates of need, which serve a purpose, but also do limit competition in some areas. They also help rural areas from spending having a whole bunch of money spent on duplicated services. But as they start to, these states are starting to do away with CONs, it's becoming incredibly competitive. And so orthopedics, you're going to see that. All these, anybody that could come up and walk in, diagnostics, they're all referral driven, but people go, hey, what about, could I go see, XYZ ortho or that diagnostic center's down the street, can I go there? So it's very much changing the landscape.
Okay, good. Thanks, Hank. And then we can ask Hank more questions at the end. Richard, you want to talk about office space?
Sure. So, listening to the presentations, I think there may be more uncertainty about long-term impacts on office than there is in retail or healthcare. I think, for example, retail, we knew pre-pandemic, the trend line retail was not good. It hasn't changed. On office, short run, as we talked about earlier, people now know that they can work from home. The technology is there that allows them to do it because they know they can do it. There's inevitably going to be more of it. So from a short-term impact, we know that's going to happen. Longer-term impact is harder to say. Working from home is not a panacea. It creates a lot of problems. And just a sort of example in my profession, working from home creates a lot of mentoring and training problems and collaboration problems with younger and less experienced employees. If you're, a task that you can do by yourself, you can do at home, or you can do at the office, or you can do in a doctor's office waiting to be seen. If it is a task that requires collaboration with other people, or if it requires you to train or mentor less experienced employees, it becomes more and more challenging to do that in a remote work from home environment. And so in particular, younger workers, if it's 100% work from home model, then really you could be doing that job for any employer. If you're just sitting in your living room, what flag you're flying maybe doesn't make a lot of difference. So there are real issues with sort of cultural erosion and collegiality and things like that the more people work from home. And so, there are a lot of intangibles that sort of go against the working from home model that people are going to have to take into account. And we think younger people, for example, who may be more focused on social relationships, who want to, be downtown or be out and about. Working from home ultimately is probably not going to be a great model for them in terms of 100% of the time. So there's inevitably going to be a counter reaction, we think, against the work from home model. Here it's going to be more than it was, but it may not be the sort of the earth shattering thing that possibly people think it could be. Now, we think one impact, for example, at least in our business, is now that people have worked from home, we may have to incentivize them to come back to the office once the pandemic is over with. We do want people coming to the office. It is important to collaborate. We do think for purposes of training younger people, it's important to have one-on-one interactions and be able to meet in offices in real time and things like that. So one trend that we think that we're probably going to see is, and this harkens back to Holly's material, is, in the same way that retail has become very experiential in terms of space, where you're trying to do something to attract people to physically come to the space, we think that office space could become more experiential as well, where you're trying to incentivize employees to actually leave their living room or their home office and come back to the office space and interact with their colleagues. So, we could see things like, although we don't expect individual offices to expand in size, I'm not sure there's going to be a lot more densification of individual offices, but certainly we think that there could be an increase in the amount of size that firms and companies want for collaboration workspace and socializing and things like that, because they are going to see the need employees back to the office and incentivize them to come and get an experience there they can't get working at home. Buildings that offer access to amenities, whether at building themselves or nearby buildings, are going to be big. Restaurants, gyms, clubs, childcare, things like that. Access to a doctor's office, those will all be important things. Obviously, companies are going to need greater flexibility in their office space. There's going to be a lot more demand for co-working. There's going to be a lot more demand for centralized administrative space. There's going to be a lot more demand, I think, for modular furniture that's flexible, that can be moved around. Less sort of big offices with fixed furniture that are going to be in place for the next 4 years. And we think that there'll be at least in the short run, we think there's going to be that the suburban offices are probably going to do well relative to urban downtown offices. As people work from home, it's going to be better for them if they're just going to go in for a day or two a week. If they can bebop over to a suburban office, that'll be a lot more convenient for them to go in downtown to a downtown office. The net effect, I think, is still unknown. I don't think people are generally bullish on overall demand for office space, but there are going to be downward pressures as people, companies may be tempted to leverage the whole work from home concept to reduce their office footprint and save money on rent. But on the other hand, as we talked about it, as companies need sort of to offer a better experience at the office, there may be a demand for more common area, more social space, more collaborative space, which could have some upward pressure on the demand for office space. So it really is a bit of a mystery right now as to what the net effect of all this is going to be and how it's going to shake out. And of course, technology is also always a wild card. This time last year, I thought Zoom was a noise you made when playing with your toy truck. And who knew about Zoom? And that's, the office home, the work from home office interface can still stand a lot of improvement from a technology perspective. And there could be changes in technology that facilitate a lot of this that we just don't even know about right now.
Richard, I was going to add a few, just to reinforce a few things you said. I read a quote about the work from home. It's good for me, challenging for we. And I thought that could be interesting in terms of focused work is great at home, but then the spontaneity and the collaborative nature is more difficult. So we're going to have to think about office spaces, like you said, as places to gather. There's going to be less density. I mean, I know for our office personally, we're going to we're proposing as the next step when we re-enter back to the office as a staggered schedule due to the density, as opposed to moving a lot of furniture around. And to your point, I think some lightweight, more mobile furniture will be, part of future office designs, but more smaller conference rooms for meetings with one or two people and the very integrated technology, I think, are going to be key, because some people are going to be working from home, some people will be in the office, still the need to collaborate. Like you said, that technology is going to be really key. So, surfaces of being able to clean surfaces, we're still working through dividers. We added some dividers. There's a psychological effect to the dividers, but also, how things are working, spread around space, how effective they are and where they go, or things to still work through. And then go ahead.
We're like a lot of people on this call, we're essentially in the human capital business. And so we have to figure out a way to develop human capital. For example, I've got a new associate who's starting workforce in January. Well, when you're a brand new associate, you stick your head in the office of partners or senior associates 30 times a day asking questions. You don't really know anything. And it's that way in new people in a lot of businesses. You just don't know anything. And it is very difficult to train those people remotely or Zoom or with the occasional call, as opposed to them being able to bebop into your office multiple times in the course of the day, or vice versa.
Sure. Yeah. And then I was just thinking one more thing is the using technology on less touching of surfaces. So, scheduling meetings and rooms and, doorways that open automatically, things like that. I mean, that's not technology we've used before to a full extent, but we'll be exploring those ideas, I'm sure. Okay, Holly, you want to talk about retail? And then I know there was a question or two in the chat, so maybe the rest of us
I was going to say, I can read the retail one, but that last question that came back in probably would be good for Richard. So let me jump up. One of the questions to the group was, let me see. Have you noticed regional differences in trends for shoppers and or retail stores? The short answer is, the southern part of the U.S. fared a lot better than the north, mostly because we have the ability to have more open air centers. You can pull up, you can walk right in. You're not in an enclosed mall. So like Saddle Creek in Germantown, the Pinnacle in Bristol, and the Avenues in Murfreesboro, those were all, if you were able to see any of those during the last 4 to 5 months, they were really, really busy. Unlike a Cool Springs Galleria, where the traffic was a lot lighter because just that mental block of being inside and not having, circulating fresh air. So, and then, Richard, did you see this question? Do you want to answer this? How much future benefit does the current necessity for working from home provide companies looking to expand employee candidate pools? Does this current environment help decrease things like the need to cover relocation costs?
Yeah, that's an interesting question. I see it more working a little bit from the reverse perspective, and let me elaborate on that. So one of my partners has a son who is a lawyer, has been a lawyer in New York City for years, and his wife works at a magazine in New York City and has for years. And in the course of this pandemic, they relocated from New York City to Memphis, Tennessee, which is where I am. And they're keeping their same jobs in New York City and at the magazine. And they have an agreement with their current employers that will allow them to work remotely for at least a year. They actually bought a house here in Memphis. And my point on that is that, I guess it's going to work both ways, is to the extent that you can hire someone for a job that's not working in the same city that you're located in and has the technological ability to do that job remotely, they don't necessarily have to relocate. By the same token, if you have employees that are currently located where you are, they have the chance to move to perhaps a lower cost, more desirable alternate, place to live, where, for example, where real estate is not so expensive, and work remotely. So, I mean, net, what the total impacts of that are going to be, I don't know, but I definitely think you'll see more of it.
I agree. So as far as outcomes going forward for retail, there's a lot, right? And there's still a lot very much unknown. Some obvious things that have come out of COVID are, for consumers, is healthier eating, spending time with the family, personal development, whether that means working out or, for me, I know that I did a lot of educational classes online and really worked on my business and my business plan. But we've all talked about this, right? It's the casualization of clothing. I mean, cozy is in, work from home wardrobe, Zoom ready styles. You see all these taglines on Instagram and everywhere else. Well, that was the demise of Joseph A. Banks and Men's Warehouse and Lucky Brand and True Religion. I mean, but then you've got, Lululemon, Peloton, Nike, and Aerie crushing it. Their numbers are better than ever. I think there's no one on this that can say that they kept a blazer on the back of their chair, put it on real quick while still in their PJ pants or yoga pants. I'd have to say I'm in my office today, but if I were home, that's exactly what I would have done. Fewer occasions. How long is this going to last? So this is a detriment to the apparel companies. You're not going to a concert. You're not going to a Titans game or a UT game. There's no charity functions. There's no weddings. So all of that equates to less outfits to buy, especially for us ladies. Outdoor space equals healthy. I mentioned that earlier about open air malls or open air centers versus malls. The more you can do outside, the better. I'm curious to see what's going to happen this winter for all of us. I think we're literally going to hibernate and be inside. I'm curious to see if that's going to cause some sort of migration to Florida. People renting houses and working remotely where it's warmer, where they can get outside. And then you have drive-throughs are more important and valuable than ever, which changes an entire footprint. You can see from this slide that Shake Shack had never done drive-throughs. They were generally on an end cap. Worst case, you'd pull up and grab your food to go, but that generally wasn't their ammo. It was stay in and patio and hang out. And so that increases their footprint, which increases the cost of the real estate and construction and so on, and requires more parking. Again, same thing with curbside pickup. If you've been to Walmart or Target, I'm a Target girl. They are taking up 8 parking spaces towards the front just for online pickup, which I utilized a ton. Had never done that before, and it's super, super easy. You're keeping, I can get on the Target app, and as I run out of things at home, I just throw it into my shopping cart. And when I've got like 10 items, I just click and go. I never did that before. I live 2.5 miles from Target, 2.5 miles from Publix. So I was not one to, I would just get in my car and go pick it up. I was not a huge Amazon person prior to COVID. Now I have way too much cardboard at my house with online shopping and experiencing that. If you have been to Walmart lately, they've got this, they had actually this scan and go, they had test marketed 5 years ago, and it completely was a dud. Well, now you have the app, and as you're shopping, you scan the item, put it in your cart, and when you're done, you go to a kiosk, you take your phone, wave it over, a magic QSR code, and you're checking out and you're out the door. There's no need to swipe everything. So that's interesting. If you haven't seen that, definitely worth checking out. And again, the economics of spreading out dining areas, with government, municipalities putting restraints on restaurants to keep their numbers, pedestrians or consumers, whichever you want to call it, customers at 25%. Well, why should they have to, and Richard may kill me on this, why should they not ask a landlord, hey, I can only do 25% of my business. Can I only, for a short period of time, only pay 25% of my rent?
That's crazy talk.
So that's, it's not crazy talk. It is. It's hard, right? It's hard on both sides, and then, again, so many, especially in Nashville with just this big boom, our rental rates had just skyrocketed, supply and demand over the last few years. And I think a lot of these retailers and restaurants were overpaying, and then this hit. And so that, it's a complete struggle. As malls reopen, they were closed for so long, they aren't necessarily welcoming back huge crowds, like I mentioned before. And predictions are that 25% of America's malls will close over the next 3 to 5 years. But look, that's nothing new. We knew and have been watching B and C malls for probably the last 10 years. It was a dying breed anyway. As power centers were becoming more and more prevalent with a targeted TJ Maxx, Home Goods, Five Below, and so on and so on. I think that you will see that almost like a rift and a shift get bigger and bigger. Let's see. And Class A malls. Well, we will always need brick and mortar. People want that experience. They want to touch. They want to feel. They want to go out with their girlfriends and go shopping. So just a cool stat to keep in mind is that 70% of overall retail sales come out of Class A malls, which is about 350 malls in the U.S. So some positives to come out of this, the retail sector is always been very, very adaptive. They're not as quick. Location, and good co-tenancy will always win. And, e-commerce is constantly a topic of discussion, but still 80% of all sales are brick and mortar. It's just a dominant way people shop. They want to get out. We're very, very social people. And I think that retail's not dead. It's just different. And we're just entering a new era. And retailers and restaurants have to think definitely outside of the box. So
Good,
that's
okay. Thanks, Holly.
okay.
That's
Yeah.
great. That's great. Well, we tried to cover
Oh wait,
a
there's
lot
one
there.
more question.
Yeah, I was going to go through that, and I had a similar question prepared. The question is for everybody. You know, there's some fatigue on signage, directional arrows, standing, what to do, when, where, and it's potentially not working. I've experienced that personally, and although I know we're getting ready to work on some signage for our office as I say that, but is what kind of, I mean, I'm seeing more signage that's more corporate in nature. I'm wondering what others are saying in terms of best practices for signage, you know, building visitors, et cetera.
I can speak on that from retail. I think retail and did a great job at the beginning. The only problem is it came at a corporate level, right? Starbucks, Target, Publix, Kroger, you know, directional signage in the aisles. It was a challenge at first, but once everybody got used to it, and then once, you know, mask mandate lifted, you saw all the arrows start to disappear. I think you're going to see those come back out heavily. I appreciate, you know, some of the corporate, you know, pushing the mask. And even I've noticed the mom and pop retailers wanting a mask to protect themselves, right? They want to protect them and their employees. I think there has to be a uniformity with it. I think that that's part of our problem is you go in one place and that's one thing, you go somewhere else. It could be different in Knoxville than it is in Memphis. Some cities are looser than others. And so I don't know about best practices because like I said, it's kind of all over the board. I don't know that one group is doing it better than others. Although I did see a Target ad on TV talking about they're practicing their social distancing and masks being required. Starbucks has done a good job of that too, just putting it out on social media. But yeah, definitely fatigue is set in for sure, without a doubt.
Anybody else? Hank, Richard, do you have any thoughts on that? What you're saying?
Memphis, we've had a mask mandate citywide from the get-go. The people have been pretty good about observing. You know, on the office sector, example here, we don't have the same level of fatigue with the directives and the signage, but that's primarily because we're still working home. We haven't really tested it in terms of getting a lot of people back. Now there are people, that's obviously not universally true. There are people who are back at the office, but I think a lot of companies are still having a significant remote work from home experience right now.
Yeah. Hank, I think you maybe, there you go.
Yeah, so I touched on it quite a bit in my conversation. It's a big deal in the healthcare world. So long lasting, I think healthcare will learn and pick up some great best practices out of this whole pandemic experience. They'll learn how to take, you know, the COVID-19 experience and apply it to the annual flu season and do a better job of managing their patient population, managing how they visit the office, keeping staff healthy. I think all of those are gonna play into healthcare long term. And you know, so healthcare, I told you, is heavily regulated. It's highly litigious as well. And so anything they can do to protect themselves, they're going to try to do. So I see that as a long-lasting impact. And you know, there will be more communication as you enter a building. There may be more communication as you enter a particular suite. And so again, that whole, hey, it's a quick little door sign or a Vista sign. They'll be interactive, and you know, we already see those, but they just haven't been widely embraced yet to have these, you know, technology-driven interactive signs at building entrances and things. Are great, but no one's wanted to spend the money. But I suspect in the future that's what you'll see.
Yeah, good point. Good point. Well, What other questions do we have? We kind of covered a lot of different things.
John, I've got couple that have come to me. One, and this relates to us here at UT, as we're getting ready to move to new office space, what are some of the questions that we should be asking or thinking about before we make that transition to new space?
You know, I'll say something about that. I mean, I think the space per person, you know, like I said, the layout in terms of, not sure everybody needs private offices. I mean, I'm not saying, I think there's still an open office concept that's out there. Thinking about everything I've been reading, you know, the 6-foot separation from coworkers is going to be important. So thinking of how much space you really need and the layouts, and really focusing on how furniture layouts, you know, how you're interacting with your coworkers, I think will be important. Also, some of the things I mentioned earlier, you know, maybe some break rooms. I mean, I'm not sure how much people are using appliances and coffee pots and other things, you know, so thinking through some of that will be important, but I think the collaboration spaces will still be necessary for smaller groups and be able to spread out, which, you know, our office got pretty dense as we were trying to get more and more in there. And I think that's why we've thought the one way we can do it is to go sort of every other day. Trying to think of what else relates to that. So total amount of square footage for your space, I think, will be important to think through. And then, you know, how you're going to utilize the conference rooms, especially. I'm hearing a lot about more healthy spaces in terms of natural light, some outdoor spaces, more access to natural light, I think, for just more of a healthier environment. One thing I've not seen yet, but I've been reading about is more green, you know, living walls and landscaping inside the building, that sort of thing.
I'll add one thing that is really not COVID specific, but I was sort of in charge of effort when we signed a new lease for our office here in Memphis. I kind of had to be in charge of that lease document. And one thing that we did in the planning for that is, and this may or may not have people's businesses, but all lawyers got the same size office, regardless of seniority, so that the offices were fungible and the same size. And that was our single, from my perspective, that was the single best decision we made in the last 10 years. I mean, the office allocation decision became kind of a 15-minute exercise, as opposed to the sort of the usual multi-day hand-wringing, wailing and gnashing of teeth exercise when all the offices are different sizes, different levels of attractiveness. So I think that's something I keep in mind as well.
That's a good point. Yeah.
Great, thank you.
Hey, John, do you think the days of open air creative space are gone? I know when I first got in the business, our first office, we had 30 brokers and everybody was in cubes, but they were nice and kind of big. And then there were a handful of hard-walled offices along the way. But the whole point was open air, creative, so you could collaborate. And then that very much here with the music industry, the cool factor, you know, the Google, you know, that kind of thing. Do you think that's gone for a while because of this?
I don't know what the long-term impact will be. I think, you know, I was thinking about acoustics, because with the open environment, you've got the acoustic issues, and especially as you're spreading people out. So even if you've got an open space, considering the acoustics, and, you know, our conference room, for example, collaborative space used to hold 10 people. I've got 8 chairs spread, or, you know, 6 chairs spread around the edge because we're only putting 4 people in here right now. So I think it's just going to be larger spaces that are arranged differently within the space. But I don't know exactly what that looks like. I've seen some speculative plans where people have been working through some of that long term, but, you know, as leases come up every, you know, handful of years, 5-7 years, and people are rethinking those spaces, I think that'll be a dialogue that they're having more and more and looking at all those different options. So I think there's still a place for it. And I think the office is going to be a place for collaboration, but doing that safely. I mean, even considering the air quality, I think the mechanical systems are going to come into place in new leases as well. as you're thinking about air exchanges, outside air, things like that. So those are the main things I'm thinking.
Gotcha.
Hi, this is Amanda with RAM.
Hey, Amanda.
Thank you all for all of your input. I'm wondering if there's just a move away from actual office space. It seems like, and Holly talked a little bit about it, before the pandemic, there were trends away from brick and mortar, more online, more experience at home or offsite type activities. And I'm wondering if the pandemic moved us so much further along that trend line that we just don't go back to thinking about work and office space the same way we have. And that just allows for more open air markets, like outdoor, more convertible spaces, working from home and maybe meeting at a park, reserving park space instead of office space, something like that, so that we're using less, and I don't mean to scare the realty folks out. Realty is not my forte at all, but that we move away from the trends that kept us boxed in and toward the trends that contribute more to individual and public health and actually health for the planet, and away from our boxed brick and mortar office spaces.
I'd love to weigh in on that, John, if I could. And
Sure, please.
guy
Please.
who's at the end of my career, not done, but definitely in the last season, I do see the work from home model having a much bigger role in the future, but I do not see it replacing the office in the collaboration effort that goes on for the folks that are in the first 5 to 7 or 10 years of their industry. That their productivity will not be nearly as great. Their learning curve will not be nearly as great if they're working remotely, in my opinion. And again, I'm a dinosaur, and I'm the first guy to admit that as I sit here. But I think as people gain their experience in their craft and earn that, you could call it that right, but they earn the opportunity, they can work remotely. And I've got people on my team that are worthy of that and are doing great. I've got others that just need to be here, not only for my help, but also for theirs to learn. And so I do think it changes the whole industry, but it doesn't, there's still going to be a place for the, I'll say the people that are new in a chosen craft. They're going to need to be engaged together on a day-to-day basis, in my opinion. And I'm just, again, a dinosaur.
Dinosaur.
No, you're not. I agree.
Yeah. I'm
totally
not
agree.
opposed to letting, I've got some people on my team, I love to let them work from home. They're great. I've got some others, I'm like, I need you here. I just need to invest time in you, and you've got a real opportunity. But, and I'll admit, I've loved working from home for the last 3 weeks. I had one of those mandatory work from home experiences where, it was based on the kind of the healthcare guidelines. They said, hey, you need to go home and hang out with your wife for 2 weeks. And it was a great experience. And it will change how I work. But and to some extent change how I view it all, but still,
Mm-hmm.
It's not gonna replace it by any stretch. It may slow down.
And it's not for everybody, right? It's not for everybody. Some people, I struggle with it big time. I have an 8th grader and a sophomore, and they're at home right now. I had to leave because they were going to be on Zoom, and I was mortified. If all 3 of us could do it at the same time, I still get to the office and have issues. So yeah. It's a balancing act that we're all learning, not to mention, depending on your house, right? If you have a dedicated office where you can actually close the door, I don't. So I'm looking out at my house going, oh, I really need to go put some laundry in or whatever. So I think we were already feeling that work-life balance anyway, and this just pushed us to really focus and think on it anyway. And I totally agree with you, though. I think this generation, coming into the workforce. You don't want them to get used to working from home because they do need to be with their mentors to learn to excel. So it's a balance.
Thank you
Yeah,
for
that's
all of
good.
that.
Yeah, I was reading somewhere about the need for HR and facilities and IT to be all working so interdependent right now, because you got people working from home with different situations, and the technology requirements there, and then what you're doing at the office for safety, that's all works hand in hand. So there was another question about sort of two questions, but one was about materials moving forward. Do you think we're going to move away from things such as carpet, area rugs, upholstered seating, fabric, space dividers, etc.? I can maybe think through that. I mean, I think the cleanability of surfaces is going to be important, and I'm not sure. I mean, there's a lot of, I'm getting up to speed with more of that from our materials that we're speccing, but I was reading about, the space pillows and all the extra things you have to make the space feel cozy. Some of that's probably going to go away just for ease of cleanliness. But how do you make the space more personable? So I don't have a great answer for that yet. I think we're still learning. I'd be interested in other people's opinions or what they're experiencing. But the
I didn't know
cleanability will be key.
I didn't know there was such a thing as a space pillow. I'd like to know where to get one.
A what?
I said I didn't know there was such a thing as a space pillow. I'd like to know where to get one.
Oh yeah, well, like a little throw pillow, I meant to say. I'm sorry. Good point. And then there's also a question about co-working spaces, filling the gap between working from home and full-time technical traditional office spaces. I don't really have any insight on that.
We don't really use them ourselves, but I think you're going to see more. I think you're absolutely going to see more of them.
Mm-hmm.
I think particularly as you go to the multiple team model, people coming in and coming out, I think that's
Right.
inevitable.
Mm-hmm.
Right.
Jump stations. Yeah. Especially when you're dealing with, and I'm just kind of thinking out loud, when you're dealing with companies that are, let's say, in downtown Nashville, but the majority of their workforce works in Williamson County, where it's a little bit looser. They're going to be hesitant to go back in. It's just a thought, will they have a small, like you were saying, a co-working area in Brentwood or in Franklin where somebody can just go in for a little while and not go all the way in like it's so far. But it's going to be interesting to, like Richard said about Bass-Berry Sims, when companies, when their renewals come up and they start polling their employees on what they want to do or what they felt comfortable with, and then you have the higher ups that look over everything at who was productive and where they were. And I think there's going to be a need from space planners to guide them through that. I think space planners are really in for having to help navigate that and help figure that out.
Did you call that jump space? Is that what you said?
Yeah, jump. I'm trying to think of where I saw that. Where, like here, and I'm in a little house in Berry Hill with 6 offices, and then the hallway, they're jump stations, meaning somebody can just run in for an hour and work at a table and leave. If you're in sales and you're kind of here and there and everywhere, you just may need to come in, crank out a couple of emails, print some stuff, and go.
Gotcha.
I know WeWork kind of had space like that and some others. But some of the larger corporations, if they're, let's say, Nissan probably has something like that where the headquarters is here, but they have people that are in California and New York and wherever, and they come in for a day or two and then they're back out.
Gotcha. Thank you.
Yeah.
I heard something similar about like some companies that kind of do have something kind of like the jump station, or there's like really no assigned seating. Is that a trend that you think is going to continue in the short term or the long term?
I haven't worked with any companies personally that operate this way, but I've heard about and read about spaces that are more just sort of hoteling. You come in and go wherever you feel like each day. And I feel like due to some concerns, from a safety standpoint, I'm reading about those offices assigning those spaces now, as opposed to just more optional. So that way there's a cycle of cleaning and using. But I also, to Holly's point, the concept of being able to come in and print and do things quickly and not stay, or even do a little bit of collaboration, I think will be important. So that kind of goes back to me to those small conference room spaces, that maybe they're enclosed, maybe they're open, but they have technology to where you can Zoom. I mean, some people may be working from home, some people may need to collaborate. So I think building in that technology, those places for small huddles that'll happen quickly and sporadically are going to be important.
Any other questions for our panelists? We've got about 9 minutes that we can use here. No? Laura Perryman, you look like you've got a question on your mind.
I'm at the UTC campus and I work in the library, which we have a very open concept, very new building here on campus that we couldn't use this semester. And so talking about, we put stuff in furniture and storage and it's like 3 people on the floor and what we've seen from some of and we have a very strict cleaning schedule because we're a state university. And so we've rubbed the finish off of a lot of our wood furniture. We're finding when we think about it, long-term planning for our building use and how universities and higher ed is changing. And of course, all of our databases are online. They're not physical. There wasn't that many physical book use anyway, but our space usage has changed dramatically and how we're dealing with that. And it is there's the signage fatigue, of course, there's generational because they're young people, but there's also we want it to be welcoming, but then we have plexiglass in front of everyone. And so it is the mix between office and retail entirely. But trying to plan for long term, and we run on a state budget, and how it takes years to implement something because it's the state. But I wrote down too, we have furniture in storage. Now, do we need to keep that furniture in storage, or do we need to get rid of it now? Because whenever we get it out of storage, it's not going to go back where it went. Like the major shifts, the huge open air computer lab. No one uses it. So what do we need to do with that space? And because we are a state, it's higher ed, it's such a long-term, and everything's so slow moving for higher ed that trying to be ahead of the curve so our students will want to be in our space, but safely in our space is still, it sounds like it's where everybody else is too. So. And I have ability to work from home because I am a business manager. So a lot of what I do is online, but I also have a middle schooler and a high schooler and a husband that's a teacher. And so if all 4 of us are at home, that's a whole different ballgame, like Holly was saying too. And so I think like for me as an employee, that's a whole different ballgame too, that's still not figured out either. So I don't have any answers, but.
Those are good questions. I've seen a couple of private sector clients. I've gone through their space, and they have furniture in their storage closets right now, as they're like you just said. So I don't know what the long-term answer is.
Yeah, hundreds and hundreds of chairs.
Stay in the storage business.
Yes.
Yeah, that's right.
Get into the storage business. I was just thinking when you said that, I didn't think about restaurants. Like, where are they putting all that?
Yeah.
That's a good point.
John,
Yeah, trying to find that balance between welcoming and safe, I think it's kind of a challenge, from what I've gathered in this conversation. But I think it was Richard's slides that had the climbing wall as the office space. That looked pretty cool. We could implement some of that in our office space here at UT.
that your
Yeah,
personal
it's-
office?
No liability associated with that, so I'd feel free to do that.
You have to sign a waiver before entering Richard's office.
That was nice. That was nice. Well, 5 minutes to go. If we don't have any other questions, if we'll go ahead and sign off here. One last call. Anybody want to ask a question to our panel of experts here before we move on from the day? Going once, going twice.
Well, this has been fun. I appreciate everybody's participation. So thank you.
Hey, this has been excellent. Yeah, it's fantastic information. I've learned a ton. I've had smoke coming off my pen. I was taking so much notes. So, appreciate it.
Thank
All
you.
you guys to us today.
Thanks,
It was,
all.
it was great. And this will be recorded. So we'll send this out to folks that maybe couldn't join us today, those that registered. And if you want to come back and review anything, it'll be on our website as well. But Richard, John, Holly, I think Hank he may have already signed off.
Lauren McCarty.
Thank you also. Yeah, Lauren. Yes, absolutely, Lauren.
Yeah.
Thank you.
Thank you so much. It's excellent.
All right. Thanks all.
Hi, y'all.
Take care.